How to survive a heart attack alone after 60. 7 life-saving tips. Imagine you're home by yourself, maybe reading a book or watching TV, and you start to feel a strange pressure in your chest. It's not that dramatic movie-style pain, but it's there. What do you do? For anyone over 60 living alone, this is a critical question. The risk of dying from a heart attack can be higher in this situation, not just because of age, but because many people simply don't know the right things to do in those first few minutes. Research shows that social isolation can be linked to around a 30% increased risk for a heart attack or stroke. And get this, in the United States, someone has a heart attack about every 40 seconds. For those of us over 60, the signs can be confusing and dangerously quiet. The 7 steps I'm about to share are your lifeline. They are designed to turn panic into a plan, and they could absolutely save your life. I'm Dr. Michael Kent, and as a cardiologist for over 20 years, I've treated thousands of patients who have faced this exact moment of terror. I've seen time and again how a few simple, correct actions taken before the paramedics walk through the door can change everything. The advice I'm giving you is the same I give my own patients. My goal here is to give you a clear plan so you know exactly what to do. First, let's clear up what a heart attack really feels like, especially for our age group. A heart attack happens when a blood clot blocks blood flow to the heart muscle. Without oxygen, that muscle tissue starts to die. This is why we say time is muscle. The longer you wait, the more damage is done. Now, you have to forget the Hollywood heart attack, where someone dramatically clutches their chest and falls over. For seniors, the symptoms are often much sneakier. It might feel like a nagging pressure or a squeezing sensation in your chest that comes and goes. But it could also show up as sudden extreme fatigue or being short of breath when you haven't done anything. It might be discomfort in your back, neck, jaw, or shoulders. Women, especially, might feel nausea, indigestion, or unusual weakness as their main symptoms. Sometimes the first sign in an older adult is just sudden confusion. Because these signs are so easily mistaken for something else, people wait. And waiting is the most dangerous thing you can do. So listen closely, because these next 7 steps are your action plan. Tip number 1, call emergency services immediately. Step 1 is the single most important thing you can do, and it is not up for debate. Call 911 or your local emergency number right away. Don't hesitate. Don't call your kids or a neighbor first. Don't decide to wait it out. The second you think something might be wrong, you make that call. Here's why. The emergency dispatcher is trained to tell you exactly what to do until help arrives. But even more importantly, the paramedics can start life-saving treatment the moment they get to you. Study after study shows that patients who call an ambulance have a much better chance of survival because treatment starts sooner. When you call, say these words clearly. I think I am having a heart attack. Give your name and your address. Don't hang up. Stay on the line with the dispatcher. This one action is your most powerful tool for survival.
Tip number 2, chew 1 aspirin. Step 2, if you have aspirin and you are not allergic, chew 1 adult-strength 325 milligram aspirin. If you only have low-dose baby aspirin, 81 milligrams, chew 4 of them. The key word here is chew. Chewing gets the aspirin into your system much faster than swallowing it whole. Uncoated aspirin is best because it absorbs quicker, but use what you have. Aspirin is a powerful blood thinner. It works by making blood platelets less sticky, which helps stop the clot in your artery from getting bigger and can even help break it down. Taking aspirin right when symptoms start can seriously reduce the damage to your heart and lower your risk of dying. But there's a big exception. Do not take aspirin if you know you're allergic to it, have a bleeding disorder, or if your doctor has specifically told you not to. For everyone else, keeping a bottle of chewable aspirin handy is one of the smartest emergency preps you can make. It's your first line of defense while you wait. Tip number 3, unlock your front door. Step 3 is a simple, practical step that paramedics wish everyone knew. Unlock your front door. After you've called 911 and taken aspirin, walk over to your front door and unlock it. If you can, prop it open. Then go lie down on the floor near the door. The reason for this is tragically simple. If you pass out, paramedics can't help you if they can't get in. They'll have to break down the door, which wastes precious seconds and minutes. Remember, every single minute that treatment is delayed, more of your heart muscle is lost. By unlocking that door and staying nearby, you ensure that the moment help gets there, they can reach you instantly. It's a small thing that removes a huge barrier to your own rescue. You're making it as easy as possible for your lifesavers to save you. Tip number 4, stop all activity and rest. Step number 4 is stop whatever you're doing and get into a position that eases the strain on your heart. You might feel anxious and want to pace around or even try to walk it off. That's incredibly dangerous. Any physical effort makes your heart work harder, demanding oxygen it just can't get. The best thing to do is sit on the floor, leaning your back against a wall with your knees bent. You can slide some cushions behind your back for support. Lying down is okay too, especially if you feel dizzy, but sitting up this way generally makes breathing easier and puts less stress on the heart. By staying still, you are conserving your body's oxygen and energy, which gives your heart its best shot until the professionals can take over. Tip number 5, loosen any tight clothing. Step 5 is another simple but helpful action. Loosen any clothing that feels tight. Unbutton the top of your shirt, loosen your belt, and take off anything that feels restrictive around your neck, chest, or waist. This does 2 things. First, it just helps you breathe easier. When you're short of breath or feeling anxious, tight clothes can make that feeling of constriction worse and add to the panic. Giving yourself some breathing room can help you feel calmer. Second, it gives the paramedics immediate access. They'll need to put EKG stickers on your chest to monitor your heart and might need to give you IV medications. Having your clothes already loosened saves them time and makes their job easier. Tip number 6, control your breathing. Step number 6 is to take conscious control of your breathing. When you have a heart attack, your body's fight or flight response kicks in. Your breathing might get fast and shallow, which makes panic and dizziness even worse. You have to try and override that. Focus on taking slow, deep, deliberate breaths. Breathe in slowly through your nose, letting your stomach expand, and then breathe out slowly through your mouth. This kind of deep breathing helps calm your nervous system and keeps a steady supply of oxygen flowing to your heart. And please, do not fall for the cough CPR myth you may have seen online. This is a dangerous idea that suggests you can sustain yourself by coughing hard. Medical experts completely debunk this. It has no scientific basis and could do more harm than good. Just focus on your slow, calm breathing.
Tip number 7, stay calm and be ready to inform. Finally, step 7 is probably the hardest one, but it's just as important. Do your best to stay calm. Panic raises your heart rate and blood pressure, which puts even more strain on your heart. You've already done all the right things. You called for help, you took aspirin, and you've made it easy for them to reach you. Now you have to trust that help is on the way. Use this waiting time to get your thoughts in order for the paramedics. Try to remember when your symptoms started and what they feel like. Are they constant or do they come and go? Is the feeling spreading anywhere? Having these details ready will help the medical team treat you faster and more effectively. Just rest in your safe position and focus on breathing slowly. You have done everything in your power. You have turned chaos into a plan and have given yourself the best possible chance of a full recovery. Of course, the best case scenario is to never need these tips at all. And while you can't change your family history or your age, you can do so much to protect your heart. Try to get at least 150 minutes of moderate exercise a week. Even just brisk walking makes a huge difference.
Eat a heart-healthy diet with lots of fruits, vegetables, and whole grains, and try to limit your salt intake. Maintaining a healthy weight, managing stress, and getting good sleep are also key. And if you smoke, please talk to your doctor about getting help to quit. Regular checkups are vital for managing things like high blood pressure and cholesterol before they become big problems. So let's quickly review the 7 life-saving steps. 1. Call 911 immediately. 2. Chew 1 adult-strength aspirin. 3. Unlock your front door. 4. Stop all activity and rest. 5. Loosen tight clothing. 6. Control your breathing. 7. Stay calm and be ready to inform the paramedics. Memorize these steps, maybe even write them down and stick them on your fridge. Knowing what to do can empower you in a terrifying moment and truly be the difference between life and death. Now, I have one last request. Please share this information with anyone you care about, your friends, your family, and especially anyone you know who lives alone. The tips you share could end up saving someone's life. Subscribe for more health advice that helps you live a longer, healthier life. Stay safe and stay prepared.